Hello everyone, my name is Drew Kennedy and I am a student physical therapist assistant from Jeff State Community College, and our topic of discussion for today is on the major opportunistic pathogen known as Pseudomonas aeruginosa. Before we begin, I would like to ask everyone a small yet extremely important question. We should all remember this as the very first skill check we were tested on. Have you washed your hands today? For now, you don't have to answer. As non-emergent as this question may seem, this key intervention could be the difference between life and death. We will further explore this topic later. First, let's discuss what exactly is Pseudomonas aeruginosa. This pathogen contributes to one of the most common healthcare associated infections. If everyone could, please take a look at handout number 1. It is an information sheet that I have provided from the Centers of Disease Control. In the United States, over 50,000 of these infections occur each year, and approximately 440 deaths are due to blame to this pathogen. It is a threatening, nosocomial pathogen, especially in individuals whose immune systems have been compromised. Now, you may remember the Department of Homeland Security formed a system alert for the public of the terror threat level in response to the September 11 attacks. It has 5 levels, ranging from low to severe. Now, likewise, the CDC has a classification system of their own for particular pathogens and bacteria. It is a 3-level system, ranging from concerning to urgent. Pseudomonas falls right in the middle, as a serious threat. It is an aerobic, gram-negative rod. The pathogen rarely colonizes in healthy individuals in the community, but it can cause disease, especially in healthcare environments such as hospitals. Premature infants, aging adults, and those with debilitating diseases, burns, or wounds have weak immune systems that place them at risk for infection. Predisposing conditions that can put patients at risk include burns, catheterization, chronic lung disease, cystic fibrosis, and diabetes. Pseudomonas presents a broad spectrum of clinical symptoms. It causes infections of the respiratory tract, the bloodstream, central nervous system, skin, soft tissues, bones and joints, and other various parts of the body. Now, in the hospital environment, it is associated with pneumonia, wound infections, UTIs, and sepsis in debilitated people. Now, when injury occurs to the epithelial cells due to a break in first-line defense, Pseudomonas is armed with proteins that enable it to invade and attack surface molecules. It can destroy host tissue due to its ability to avoid the human body's inflammatory and immune response. It is one of the leading causes of nosocomial pneumonia, especially in patients on ventilators. Pseudomonas accounts for 10% of all hospital-acquired infections. The prerequisites for growth and reproduction of this bacteria are undemanding due to low nutritional requirements. This pathogen finds numerous moist reservoirs to thrive in, such as respiratory equipment, sinks, toilets, and showers. In the hospital, environmental contamination can occur from patients being transferred to and from other facilities. Healthcare providers have been known to spread this pathogen by their hands from patient to patient and by direct contact with contaminated sources. While rare, healthy people can develop illness with Pseudomonas, especially after exposure to water. Inadequately chlorinated hot tubs or swimming pools may lead to skin rash and ear infections that are more frequent in children. Hot tub rash is an infection of the skin known as dermatitis. It can affect all ages ranging from babies to older adults. Most of these rashes clear up within a few days and do not require medical intervention. The diagnosis of Pseudomonas aeruginosa depends upon laboratory identification. To diagnose it in deep organ tissues, imaging techniques such as X-rays are used. Body fluids such as urine samples, blood samples, cerebrospinal fluid, sputum, and drainage from the site of infection can also be cultured. It grows well on most laboratory media. Pseudomonas is identified by the fluorescent green colors and colonies that it produces, its characteristical fruity odor, and its ability to grow at 42 degrees Celsius. Most Pseudomonas infections can be successfully treated with antibiotics and/or surgery. Medical management is determined by the site of infection. Medical intervention should be immediate. Pseudomonas has a protective outer barrier. Overprescription of antibiotics today has contributed to its ability to resist antibiotics. Infections are usually treated with 2 antibiotics. Most antibiotics are administered intravenously or orally for 2 to 6 weeks. Treatment sometimes requires surgery to remove infected or damaged tissues. Infections that progress to sepsis are associated with a high mortality rate. The difficulty of treating Pseudomonas infections with antibiotics is most prevalent in patients with cystic fibrosis. Once acquired, it is virtually impossible to eradicate. Despite more than 40 years of vaccine research, there is still no vaccine available. Now, as physical therapists and physical therapist assistants can contribute to the control of this opportunistic infection. Promoting education on proper hand washing to healthcare providers and patients is one tool that can be used. Wash your hands and equipment. If there's not a sink available, use hand sanitizer or alcohol wipes. They are both very effective. Now, as I asked you earlier, have you washed your hands today? This is an important question to answer. How you respond can have a direct impact in the healthcare setting that you are in. I like to call it the 10 most common causes of infection. The cheapest and easiest way for infection prevention is hand washing. Please look at handout number 2 that I've provided you. This is a free downloadable brochure made available by the CDC that can be used by physical therapists as a teaching tool to educate patients on hand hygiene. It is a patient's guide that explains how proper hand hygiene is the #1 technique for preventing the spread of infection. Now, lack of compliance in hand washing has been documented in several studies over the past 2 decades. Partners in Your Care was developed as a patient educational tool emphasizing hand washing behaviors to equip the patient with responsibility for their care. The program was implemented and studied in an acute care hospital in the Oxford, United Kingdom. Patients were asked to assist in the program, Partners in Your Care, by asking all healthcare workers that had direct contact with them, did you wash your hands? This program increased hand washing frequency to a staggering average of 50%. Now, another key intervention is early detection in wound care. Therapists need to remain alert to the development of medical complications such as discoloration of wounds, drainage, odor, and delayed healing. Increased pain should also be noted. Any change in wound appearance should be reported. Physical therapists can play a key role in minimizing the impact of this infection through early detection and appropriate referral. The outcome of Pseudomonas aeruginosa infections can significantly impact daily function and overall quality of life. For example, in the presence of hand burns, Pseudomonas aeruginosa interrupts the body's normal processes due to infection of the skin or soft tissue. Impairments of the integumentary system include pain, inflammation, edema, impaired sensation, and decreased range of motion. For example, this hand represents a patient being infected by the Pseudomonas aeruginosa pathogen after a burn. My other hand represents a patient that does not have it. This hand right here represents the decreased range of motion. Psychological impairments also include depression, anxiety, loss of self-esteem, and inability to socialize. In regards to low self-esteem, a patient that is not motivated will most likely have a delayed recovery period. Off to functional limitations of a hand burn. This can affect many things such as grooming, dressing, eating, writing, and typing. So as you can tell, ladies and gentlemen, this can affect numerous things. Disabilities may occur if the infection does not respond to antibiotics. In some cases, amputation may be required, and as we know from work hardening and work conditioning, job reassignment might be necessary. Now, specific interventions depend on the site of infection. Possible interventions for infected wounds include high-volt E-stim for tissue healing and gate theory management for pain. This would increase blood flow and tissue oxygenation. Debridement to remove necrotic tissue to allow for a healthy wound bed and applying a topical antibiotic along with sterile wound dressing. Possible interventions for lung infections include chest percussions, to loosen mucus to allow it to be cleared by suctioning or assisted coughing techniques, and breathing exercises to strengthen muscles used for inspiration to improve aerobic capacity. Pseudomonas aeruginosa has been a major problem in the healthcare setting for many years and continues to be one of the most opportunistic pathogens. The CDC recognizes multi-drug resistant Pseudomonas aeruginosa as a serious level of threat in the United States. Key interventions aimed at reducing the risk of nosocomial infections should be priority. Physical therapists can play an important role in the prevention and management of this serious health threat. As this concludes our discussion of Pseudomonas aeruginosa, remember, prevention is better than a cure. Make sure you wash your hands. This concludes our discussion for today. Thank you for your time.